Let's talk about the treatment of refractory ulcers. Typically, standard care is provided for 4-week periods because the wound they don't reduce in size by more than 50%, but after 4 weeks, refer to other medical center or specialist is often indicated. Standard care includes ensuring good vascular supply, preventing and treating soft tissue and bone infection, performing excisional debridement, maintain debridement or crucial important problems, and make sure the patient adhere to your medical advice and sometimes even high quality offloading. Numerous therapies can be applied for those ulcers. However, not many of them have high evidence to show it really help healing ulcers. But we still can use this material, wound dressing material, to treat the patients. Here are the abbreviations, and I show you the abbreviation here, like PRP, DSS, or HBOT. And I know maybe you don't have so many treatment in your office, in your hospital, but in my experience, if you can follow my experience, maybe you don't need to use negative pressure wound therapy. You don't need to use hyperbaric oxygen therapy. You just need to treat by regular or simple wound dressing material. It also can help wound healing, but you have to follow my lecture. I will show you how to treat them more quickly, or let the patient heal more quickly. And in my experience, many referred cases don't heal more than 4 weeks or even 6 months. If you perform debridement and good food care for the patient, but the wound didn't heal or improve much, please re-evaluate the foot ulcer or wound again. In refractory ulcer or wounds, I often see patients are mistreated. For example, if the wound is caused by venous disease, you should try to aid compression therapy rather than repeat surgical debridement again and again. And as you can see in the photo, the left one is venous ulcer related symptom. You don't just change antibiotics again and again. You may just aid the compression therapy. Don't forget it. But beware about ischemia symptoms. So sometimes I would like to exclude the artery problem. If no artery problem, maybe I will think it's a venous situation lead to ulcers and add compression therapy. And there are many bandages for venous ulcer. In my experience, even simple methods like the photo C, it still works. You don't need very expensive bandage. If you have, okay, but if you just have simple one or easy one, it's also helpful for the wound ulcer healing. Do you ever teach the patient to exercise and how to exercise? There are many articles or research discuss about the exercise for diabetic foot ulcers. I will recommend the Burgers exercise. if you want to accelerate the wound healing and teach how to do exercise. And in this research, we see the comparison before and after exercise training, the concentration of oxygenated hemoglobin increase. So the figure tell us really after exercise training, the circulation, the oxygenation situation improve after exercise. As you see, the bar increase. Let me show you some cases. A diabetic patient has wounds at right lower leg, but the wound didn't have any improvement after 6 months treatment at another medical center. Then the patient come to me and I just take a thermal image of the leg. As you see, the blue color shows cold temperature. This wound is very cold. It's not very hot wound. So the circulation maybe not so good. And you can easily see there's poor circulation around the wound. It is unfortunate that no one tells or teach him how to do daily exercise for wound healing. And then, yes, the wound later healed. Why? We teach him to do the full exercise for wound healing. Then after a few weeks after, his wound healed. No expensive drug, no expensive surgical treatment. We just prescribe the exercise plan for him. So remember, exercise as medicine. And I'll show you another case. A diabetic patient have wounds at right lower leg for more than 4 years. 4 years. Whoa, very long time. And in the treatment history, the patient received wound debridement, hyperbaric oxygen therapy, and even 3 times perivascular intervention at his right leg. But the wound didn't heal. And the patient was referred to my clinic. As you see, the wound is at the ankle. But in the physical examination, I feel the circulation around the wound is good. I don't think repeat vascular intervention will help him. I think repeat perivascular intervention won't help wound healing in this case. So I don't recommend repeat perivascular intervention. But what happened? I checked the nutrition status of this patient and I found that although the patient has good glucose control, but he has zinc deficiency. It's a minor nutrition, and zinc deficiency will delay wound healing. After zinc supplement and our standard wound cares, his wound healed.